right, welcome to episode 2 of HealthTech Stories. Today we are going to dive into the economics of healthcare. Steve and I are super excited to welcome Chief Digital Transformation Officer John Barto today to chat about everything from cloud investments to the impact of consumerization and regulation in healthcare.
John, I'm really happy to have you here. You and I have worked together a lot over the past several years. I've learned a ton from you, not just about like curating epic facial hair, but all kinds of things about the industry and where it's going and where it's been. And you'd have a real rich history in healthcare and technology. So I just wanted to start off by asking you one thing that maybe will help the audience get to know you a little bit better. Tell me about you decide your first job or your worst job.
Well, I might take both. So the first is
Okay.
really easy. I started working when I was 11 years old, and I had something that probably doesn't exist anymore, a paper route. I used to actually pass newspapers around and go collect money and all that kind of stuff. So that's probably not a job that's even there anymore. So the story there is, the job you want tomorrow may not have been created yet today, or it might, the one you have today may be gone by tomorrow. So
Hmm.
but the other side of it is maybe the worst job. I actually got out of the healthcare industry at one point and went into electronic design automation capabilities. And I didn't understand the industry well enough, and I struggled a bit because I didn't understand the industry. Used a lot of great skills on how to sell things in this space, but it just was never really my cup of tea. I'm really focused in healthcare, been invested in it for years, and it's helpful when you understand how the industry operates.
Yeah, okay. That's great. I have to say that your worst job doesn't sound all that bad. Someday I'll tell you
Yeah.
about my worst job. Multiple. Anyway, thanks so much, John.
Yeah,
No
thanks for
problem.
sharing, John. Can you expand a little bit more about your background and how you specifically became interested in the healthcare industry?
Sure. I'd started out when I was in college. I basically got a job in college as an operator at a hospital. It was my first tech job, and basically through attrition, I actually worked my way up to become the CIO of the health system. And if that would have paid well, I probably would have still been there. But eventually, I figured out I needed to have some more substantive pay. But every job I've had since then has been included in some way in healthcare. So I sometimes call myself a recovering CIO from a hospital, but I've actually spanned across many different aspects of healthcare. I've done work in the payer space, I've done work in the pharma space, I've done work in the med device space. So I've done quite a bit across the industry, and I'm proud to bring my skills here to Microsoft and engage with some people that are doing some amazing, innovative stuff in the healthcare space.
Yeah, that's fantastic. So switching gears a little bit, we've got a brand new administration in office.
Mhm.
Um, I feel like there's some uncertainty in our healthcare organizations about what's coming up next. What are things going to look like over the next 4 years? Um, how would you describe the current economic landscape of healthcare in the US?
It's actually pretty easy for me, Steve. It's kind of unsustainable the way it is right now. We're asking for far too much out of people that don't get compensated for many of the things, and we've really got to start applying some innovation. Every other industry's actually had innovation. We just haven't applied it as heavily in a regulated industry like healthcare. So I think there's going to be some drastic changes. I also believe that consumer expectations are starting to change quite substantially. We have people like Amazon delivering things instantly to my door, or I can go get an experience around a cup of coffee at Starbucks, or, these various things that are shaping experience models that, generations beyond me are starting to say, I demand that, and healthcare is going to have to find a way to keep up with it. And that's going to be extremely difficult. In fact, that kind of leads me into a thought I had is I'll never forget one conversation I was having with the CFO of a health system. Just to kind of set the stage, we got invited to the board meeting. We'd finally started selling enough technology to this company, and I won't mention who it is, that we got invited to the board meeting. So they invited us to work with them from 5 to 6 o'clock in the evening on the day before a holiday weekend. And I didn't happen to live there, so I wasn't getting home that night, that's for sure. And we got into the conversation, supported by most of the C-suite. And the conversation stopped pretty abruptly because the CFO said, I'm not really a technology person. explain to me why I'm being asked to invest so much money in cloud computing. And much to my surprise, there are a lot of people that kind of sat there, even their whole C-suite, and didn't really have an answer. Maybe it's because I've been around sales long enough, Steve, that I can't let dead airspace happen sometimes. So, so maybe that's what it was, or maybe they really did sit there a little long. And I just raised my hand. I said, I may not be the best person to answer this question for you, but I'm willing to give you a strong perspective on it. And she said, I'd love someone to give me a perspective on it. I said, well, here's what you got going on in this industry right now. You've got expectations being grown by every other industry. There are people coming from a consumer side of the business trying to acquire the patients and members and those folks that come to you for care.
Mhm.
They're also chasing the people that you have working for you. They're trying to they're giving a better experience to those people. And here's the root of the problem. I was a CIO in a hospital for a few years, and I'm here to tell you that your adoption of technology takes on average 15 years. By the time from the time a piece of technology is conceived until it runs through all the regulatory cycles, has been adopted by somebody, finds its way into the hands of one of your doctors, your nurses, your patients, your members, it's probably about a 15-year cycle. Those consumer companies are churning an experience every 6 to 10 days. So they're creating an experience that people want much faster than you are. Now, I realize that they have some restraints because it's a regulated industry. They have to be careful about how they do it. But if you're not careful, they're going to start taking all your members, all your patients, all your employees, and you're going to be left with these big assets called hospitals, and you're not going to be able to deliver anything. And it's going to be an ugly situation. You've got to innovate. You've got to innovate faster. Innovation's happening in the cloud. That's why you need to move most of your materials, most of your data footprint into the cloud. And that was it was interesting because when I was done with that little conversation, she actually said, "Would you be willing to coach me a little bit on technology? Because you probably gave the best position message that I've heard about what the value case is for why we're being asked to do cloud computing." I thought I'd share that with you.
Yeah, I love the story. I think the client example is great. And the overall lesson that we should learn from it is apply innovation, but also at the same time, make sure it's quick and like you said, innovate faster. So
Yeah.
I love it. I guess you kind of shared, how the current economic landscape is. How do you think we can get to a better place? I know you kind of touched on it a little bit, but if you could expand just a little bit more on that.
And I would say even outside of technology, I mean, if this situation is unsustainable, what are the ways that we can get out of it?
Yeah. Um, well, the piece I have to add to the unsustainability is realize from a population perspective that 10,000 people a day are retiring. So our workforce is aging out. We don't have enough people to work, right? We didn't have enough people before. Now they're all aging out. And so it makes it even worse. And the other thing that we've got a problem with is that as you get older, you need more care. So we've got more demand on the system and less workers to do it. So one of the things we've got to do is get extremely efficient in how we apply human labor to this situation. The only way to gain that efficiency, in my opinion, is to actually use technology to help those humans do things much quicker, right? And there's always this conversation of, will I lose my job to AI, right? I don't know that that's the right conversation anymore. It's like, well, we have enough humans when we actually apply AI to still do the job, right? Like, there's not enough humans to take on the task that we need to take. So I think there's things in that space, but I also see the industry itself dissecting itself into some specialties. Like, if you think about the traditional hospital, um, the value case of the hospital is changing because things like medical imaging are going outside the traditional hospital. Things like infusion services, even, are going to home based care. I think there's going to be a lot of need for us to be able to care for an individual, regardless of what the geographic separation is between the care provider and the caree. I do think technology can help us a great deal there. But the thing I worry about the most is how rural care is going to be taken care of in this world, particularly in the United States going forward. We're struggling there really bad. There's doctors don't want to go out there. patients need care, they're probably in that elder model because most of them are, in that situation. And it's very difficult to deliver care in that space. And technology's, in my opinion, one of the best ways we can focus on doing that.
Hmm. Yeah, that makes sense. Um, I had something, this is a little bit deeper topic, I guess. I wanted to get your thoughts on three different areas. Consumerization. So this is, more ways of interacting with your provider. Some of the startups that are in the business now, people moving to chat, or people also not being so not being so loyal, I guess I would say, to their doctor, not having a
Yeah.
lifetime doctor anymore, sort of
Yeah.
shopping around. So consumerization, payment reform, so talking about
Yeah.
Medicare,
Yeah.
Medicaid reimbursements, and then regulation. So what are some of the things in those three areas that are affecting the healthcare industry now?
Yeah. So I'll start off in the consumerization
Yeah.
space. There is a drastic change. In fact, statistically, if you look at Gen Y and Gen X, their behavior's changing quite drastically from former generations. Like Gen Y will shift the provider they talk to just based on the website that's presented. So if you have a good portal, you can get some of those younger populations.
Mm,
Gen X treats their healthcare like they treat everything else. It's a gig economy. Like they don't own cars. They basically jump in an Uber to get from place A to place B. That's the way they're starting to assemble their healthcare. They'll go to a
mm,
retail clinic if they need something that that can be done. They'll go to telehealth. They'll cobble together their healthcare in the same fashion that they do everything else around the gig economy function. So we're already starting to see drastic changes in consumers' expectations and how they're driving that with the economics with the way they're looking to get care delivered to them. So I think that's a big part of it. I also think on the consumerization side that there is some real work being done by some of the larger organizations to actually focus on the consumer. I haven't seen that in healthcare for years. And that's what's changing some of the nature of maybe taking it to a chat mechanism. I even saw one care provider that's getting rid of all their portal properties and actually running that through a full chat vehicle. So
mm,
there's some very interesting things going out there on how do you change that. The second piece I would talk about is payment reform. I think that was the part you asked about. And for that, I think we have to spin the clock back a little bit and realize that when healthcare really started in this country and how hospitals got started, they were actually managing infections at that point. And then we had this miracle drug come along called an antibiotic, which we've perhaps overused at this point, which allowed us to control infections. And the job of the hospital changed. The job of the hospital changed into um, since we became a much richer population, we started getting these comorbidities, we started getting some of these chronic illnesses. And frankly, the job of the hospital over the last probably 15, 20 years has been focus on those with chronic conditions and the off spins of those chronic conditions. And the thing that we're starting to try to do in healthcare is change the conversation to being proactive about your health. And frankly, I will give credit to the younger folks. They're really focused on their healthcare. They actually want to be proactive about their health, right? And not get themselves trapped into chronic conditions. So we got to provide them support mechanisms to do that. We still got to continue to manage the chronic side of the business, but that's why payment reform's been happening, because what we're starting to do is incent people to focus more on preventative
mhm,
capabilities than on reactive capabilities. I
mhm.
always said that if you wanted to go somewhere for a diving save in your healthcare, the US is the best place to be. We're great at reacting to any condition that shows up at one of our health systems.
Yeah.
But if you want proactive care, which is actually much more cost effective, it's a combination of culture, teaching the people that's what they want, and a combination of incenting people to go that direction. So that's where I think the payment reform stuff comes in.
Mm,
The last thing I'd say is on the regulatory side.
yeah.
Um, we're when it comes to healthcare, our regulatory bodies sometimes are scared. Like they're scared of things like Vioxx. You may have heard of that case where
Mm,
they released a drug and ultimately it ended up killing some people. And that's what the regulatory agencies are there for, is to protect us from those types of things. But there's a delicate balance between that and the fact that we don't have enough labor to deliver care. So should somebody go uncared for because we don't have the labor and we can't get the regulatory organizations to allow us to use technology to fill in some of those spaces? Is that
Mm.
worse than the risk of something like the Vioxx thing, right? And that's a balance we've got to figure out how to strike in regulatory space. Great example, in my opinion, is if you look at medical imaging, there's other countries that are doing advanced medical imaging reads without a human involved. And they're doing more and more and more of those because the technology is good enough to do that. But there's still their radiologists, all their ologists are still extremely busy because they had too much of a workload before they started doing that. They're only diminishing that workload and making sure the things that really need human eyes and specialization get put in front of those humans, and we use it that way. So I think those are kind of, I think on the regulatory side, it's a really delicate balance, but we've got to start loosening and really start to understand how technology could help us in some of these spaces so we don't regulate the lack of use of it.
Yeah, that makes sense. I mean, I hope that we've learned enough to prevent the next Vioxx.
Yep.
You never know,
Yep.
but hope so.
I hope so too. And
Yeah,
that's why we're so restrictive on some of the stuff, is because we're very concerned about things like that.
yeah.
Exactly. And I like how you mentioned how, consumer expectations are changing, especially with the different generations. And we have to be able to adapt to that to make sure that everyone's able to get the care they need. Also, in addition, like you mentioned, on the payment reform side, being more preventative than reactive, like that's a
Yep.
really big thing. So I guess, John, if you were to say, I guess like one or a couple pieces of advice for healthcare organizations that are looking to thrive in this new digital landscape, what would you say to them?
I would tell them to take a really strong look at a consumer approach.
Yeah.
Quite often, if you're a healthcare system, you're a delivery vehicle, and you don't really engage people until they show up at your door,
Hmm.
right? I would say get more involved in your community. Make sure there's more of a consumer awareness of what you're trying to do. Engage those folks before they actually need reactive care.
Yep.
Get focused on some really proactive stances and change the brand that you're living in to one of a health advocate or a health, associate versus a healthcare delivery player, right? And that's not going to work for everything. We're still going to have the reactive care that's required and all that kind of stuff. And some of it has to do with patient behavior, because the only person that can truly affect their health is the patient, because they can do what the doctor tells them to do or not do what the doctor tells them to do. I do think that we're in a state now where we can start to get some early diagnosis technologies out there that we didn't have before. Like some of the fascinating things that are happening in technology. I don't know if you've heard, but there's been some findings around how biomarkers in your speech can tell whether you've got a mental or a neurological condition. It might be early onset. Some of those early indicator things are fascinating because it's going to give us a triage long before we would have ever seen it before. And like even in the Alzheimer's space, if you think about that, there's been drugs generated for Alzheimer's for a number of years, and most of them have failed. But people believe in that space it's because the buildup of the condition, you need to catch it early, right? You can't wait until
Hmm.
you're 10 years into an undiagnosed condition to start treating. And we think that those drugs could have produce a better life for those people that are afflicted with Alzheimer's if we knew earlier and we could provide them earlier, right? And then there's also other workaround mechanisms. It doesn't always have to rely on drugs. I know I come from that generation. Take this pill, right? But there's also other workarounds once people know they have a condition. And I do think that we need to, as health systems, get more in focus and in tune with that.
Yeah.
If you were in the retail space, you wouldn't get away with providing something nobody wants,
Yeah.
right? Or not giving it to them the way they want it, right? You see that from shopping malls that are going away now that Amazon's delivering to my doorstep, right?
Hmm.
Exactly. Yeah,
Yeah.
that work in biomarkers is so exciting. Um, we had talked previously, John, about get helping our provider friends get in control of their data, and you had some opinions around
Yeah,
that
yeah,
um, in terms of kind of creating connections between IT and the rest of the clinical staff. Do you want to talk about that a little bit?
Yeah. So it's interesting. I'll use a reference to a group I just got out of. I was sitting on a stage in a panel session, and the question came to me is, well, AI is getting better. Why don't I just wait for a few years until like the AI is good enough and I don't have to do a lot of energy to use it and stuff. And I don't want to do the switching costs from one AI model to another AI model, all that kind of stuff. And I kind of just sat there and I looked at the audience. I said, so there's one thing in common with all these AI models. And that commonality is that the more organized your data is, the more accessible your data is, and you can set it beside that model, the better off you are. So as the models change, as things change on how analytics works, if you can organize your data, you're going to be in a much better position to actually leverage those things as they come along. And the nature of change that's going on is someone's going to beat you to that if you don't get yourself organized and do it. And you might be in that same conversation I was having with that CFO is, you may find yourself not reacting quick enough. And so you're not going to get the advantage of the technology that's allowing others to compete with you. The big thing for me is get your AI or get your data in a space that's going to allow AI to come to you. Find a provider that's going to basically provide the latest in AI as it changes, and make sure that you leverage that capability. Sometimes you're going to have to wait on regulatory. Sometimes you're going to have to convince consumers that they need to use it. But the best position you can be in is get that data there. And I do think this is going to be a little controversial. I do think many of the health systems we have in the US are held hostage by the people that build their applications. And it's not malicious. I understand they're doing it for safety reasons, but you can't wait on those providers to provide you innovation across the board. The other thing I would suggest is go look at a large cloud player that's providing innovation across all industries, not just one, right? I hope you'd look at Microsoft because obviously I work here, but even our competitors, if you get yourself settled, your data footprint settled in a place where they can provide you innovation that's funded by every industry, not just healthcare, I think you're in a far better position because this stuff's going to move much more rapidly than healthcare is going to be able to keep up with it. And I don't want you to get into that same condition we talked about with that CFO sometime
Exactly.
back. So
Yeah, well, it's not the first time I've heard about some of these software companies that are, as you said, not maliciously doing this, but I think there's some paranoia maybe on their side about
Yeah.
FDA compliance and
yeah,
the risk, the perceived risk on their
yeah,
side of doing something wrong. But it may also be overstated on their part.
yeah.
Mhm.
And I do think I don't know where you find the balance, but it does stymie innovation.
Yeah.
Right? Innovation can't all come out of one company. As much as I'd like to say it can, I mean, I work for a company that we think we can help foster most innovation, but even Microsoft looks at it this way. We're not going to have the intelligence in every area. It's going to come from our partners, and that's why we build the ecosystem we build because we want to get access to the latest innovations as quickly as possible, so we can actually start driving improved care based on those.
Yeah.
Mhm.
Makes sense.
Yeah, I love it. I think in order to be the leader, like you said, get the data in order, and then you'll be able to use, the latest and greatest technology. And then I also really liked what you said earlier is change your brand to be a health advocate
Yeah,
versus the healthcare delivery player. That really resonated with me. I love it.
yeah.
Hmm. Nice. Hey, John, I think we have to wrap up. This was fantastic to talk to you as always. I think we're going to have to do another episode later on because there's a lot
Yes.
more that we
Oh,
want to learn from you.
well, thank you. And thanks for letting me be your economics professor in our master's program. It's been a fascinating ride. I learned a lot from that. So thank you both.
That was a great learning experience. All right. Thank you, John.
Thank you. Have
Thank
a good
you.
day.
Bye now.
Bye.
Did I
Yeah.
swear? I want to know, did I swear?
No. So you'll get
No,
another chance next time.
Oh, shit.
Yeah.
you did it.